Hello, and welcome to this next section on the history and physical examination in 2023. I'm Dusty Otwell. I'm the Vice President for Claims and Risk Management at U.S. Acute Care Solutions. We're going to talk about the new guidelines and requirements, and I'm also going to throw in a few medico-legal tips when I get a chance. So when it comes to the history and physical exam and the new guidelines, first, let's take a step back. Let's look at how it used to be. And here are the requirements, the guidelines right here. Now you'll see it's very quantitative. 1, 2, 3, 4 or more elements for HPI, review systems, all the rest, to get from 9928. 1, 2, 3, 4, 5. And it was a real kind of numerical system. You got to check off these boxes to give the coders what they need in order to select and justify a code. And this is, E&M, of course, but it was similar for hospitalists, for inpatient, for observation as well. All very quantitative about, hitting the requirements, checking off those boxes in order to get the code that you deserve. Well, that has all changed. In 2023, now we have, the history and physical exam, and that's no longer an element in the selection of the E&M code. Now, it's still required that you do a medically appropriate history and physical exam. But now, what is medically appropriate? That's up to you now. And that's a good thing. It's not up to a coder, it's not up to an insurance company on what is medically appropriate for an individual patient when it comes to billing and coding your chart. So look at this very positively with the change. It's not about, checking off boxes and getting to the number of requirements that you need in order to get the code that you deserve. It's about treating your patients in the way that you know is appropriate, and then, very importantly, telling your story in the documentation for how you treated that patient. Now, in this change, we've gone to a very minimal system of requirements. So I even, point out and/or, which is kind of an awkward term, but or is involved in that term. So it's now history or physical exam. And that's an illustration of how, minimal we're getting in these requirements. But when it comes to your documentation, for all sorts of reasons, including, legal defense, we want to do more than just the bare minimum on the documentation of our charts. So organizations, hospitals, physician organizations, you very well may want to set your own minimum requirements for what is necessary in the documentation of a patient encounter. Because again, we've come to a more minimal set of requirements for documentation, but we're almost always going to want more than just the bare minimum when we're talking about documentation of a patient encounter. So now let's get into some specifics about the changes.